Johnson City Medical Center getting a new emergency department and a major ER expansion after Ballad Health approved a $60 million capital investment. Good evening, I'm Casey Marler. Sarah Diamond has the night off. The Level 1 Trauma Center located at 400 North State of Franklin Road in Johnson City. The project was first proposed earlier this year. Leaders say planning will begin immediately. News Channel 11's Jayana Scurry is there now and has been following this all day. Jayana, what can we expect from this expansion and what will it mean for the community?
Hey Casey, this expansion will provide the community with a more modern ER that will be around 35 to 40% larger than what it is now.
And I think anybody that's used the emergency department at Johnson City Medical Center knows that space is an issue, that it's outgrown its current space.
Ballad Health CEO Alan Levine says this expansion is probably the biggest medical project that will be built in the region in the last decade. The number of rooms will increase from 36 to 55, and 2 more trauma rooms will also be added. Levine says the medical staff has advocated for this investment for better care of patients.
We hear from the patients that the rooms are small, and sometimes even you have patients in beds in the hallway because we're at capacity. And when you hear those complaints, you take them seriously. And so, we want to make sure that we're responding to the needs of our patients.
The goal is to make this a state-of-the-art facility. The expansion allows room for new advanced technology.
A great example is an ultrasound used to check for blood in the abdomen for an injured patient at the bedside without having to go for a CT scan. Didn't exist when our trauma bays were built. We use it every day. It's an additional piece of equipment in a tight room.
David Wild, Chief Medical Officer for Johnson City Medical Center and for all of Ballad's Southern region, says architects will get input from physicians, nurses, and other medical staff on the design process.
When you ask the people who do the work every day what you like and don't like about your current space, what you would need or choose to have if you got to design it from the ground up, we learn a lot about what could be better or what our teams could use that maybe isn't the easiest now, even if it's available for them.
Levine says the expansion will allow for more privacy. A more modern, larger waiting area will also be constructed.
When we build these new rooms, they'll be bigger. They'll be, if a patient needs to stay in the ER longer, that they'll be much more comfortable environment. And of course, we want to build a waiting space that is a lot more centered around the patient experience.
Levine says the next step is the planning process. They expect the new ER to be completed by 2027. Live in Johnson City, Jayana Scurry, News Channel 11. Back to you.
Jayana, thank you very much.